And welcome back to Show Me St. Louis. August is National Breastfeeding Awareness Month, so it only seemed fitting to share some exciting news. SSM Health DePaul Hospital is joining a growing list of more than 20,000 baby-friendly hospitals and birth centers throughout the world. We sent our associate producer Mary Thayer to DePaul to meet with a lactation consultant who dedicated years of her career to receiving this honor for her hospital. Take a look.
August is World Breastfeeding Month, and so we always celebrate that. And so not only just to celebrate World Breastfeeding Week and World Breastfeeding Month here, but we're celebrating us too.
After a rigorous review process conducted by Baby Friendly USA, SSM Health DePaul Hospital is proud to announce that it has achieved the highly prestigious International Baby Friendly designation. This distinguished honor demonstrates that DePaul Hospital is adhering to the highest standards of care for breastfeeding mothers and their babies. Lactation consultant Shannon Schrum says that the Baby Friendly designation took years of hard work to prove that DePaul provides an environment that supports breastfeeding while respecting every woman's right to make the best decision for herself and her family.
We had to go through our policies and direct those so they're best practices. And through that, we educated our staff, the nurses, as well as the physician on those best practices, and then rolled that on out to the patients. And it just took a lot of just encouragement, a lot of education, and then putting that into practice, and culture changes for just practice is big. But after a couple of years of that, getting on board now, it's just another day at work for all of us here at DePaul.
These best practices and training are built on the 10 steps to successful breastfeeding. The steps are a set of evidence-based practices recommended by the World Health Organization and the United Nations Children's Fund for ideal infant feeding support in the first few days of a newborn's life.
So it's all about educating. So not only did we educate our staff, but now because we're educated, we can educate the patients on the benefits of breastfeeding and educate them on formula feeding as well, if they need that, and then help them make the best decision that they need for their family and what's going to work for them. Then we support them with the skills that they need and just walk through this process with them so that they're prepared and just confident for going home.
And it would not be possible without leaders like Shannon.
It just comes easy to me, for me, but it is best practice. So providing our families with the best start here at DePaul is our goal, and just knowing that we're doing the best, most highest standard of care for them to get them off to a good start.
All right, for more information on that baby-friendly designation, you can visit that website right there on your screen. And here to share a deeper look into those 10 steps for successful breastfeeding and a look inside their recent designation, we have pediatrician, we have Dr. Elizabeth Bergamini. Thank you so much for joining us today.
Yes, I'm glad to be here.
Well, first and foremost, we do want to say congratulations.
Thank you.
This is a highly prestigious honor, so why don't you just try to explain to people how important this recognition is?
Yes, so it's very difficult to get in the first place. Like Shannon had mentioned, it took years. All of us had to go through training, all the nurses, all the doctors, anyone that was going to be patient-facing, dealing with the moms on labor and delivery, needed to have specifically tailored education and go through all of that to get this. And then we had to go through a review process through Baby Friendly to ensure that we were compliant with all of their specifications, and it took a site visit and lots of time and effort, especially on Shannon's part, to make sure that we were all up to date, and then we finally got it.
And when it comes to some of those standards of care, what does that look like that you are adhering to?
So a lot of it surrounds the support of moms.
Yes.
And helping them through, especially those initial days of breastfeeding and just the baby's life. Those days can be crazy in general. There's a lot going on. So making sure that we support them, show them how to initiate breastfeeding, how to maintain breastfeeding, and what to do if difficulties come up, like a poor latch or baby's too sleepy, things like that, how to troubleshoot. Also, we have a breastfeeding policy that is posted all over for all of us to review, talking to families about the importance of breastfeeding, and then also things like, you know, it comes up a lot, do we need to supplement, and when do we supplement? Because I think people jump to that and think, oh my gosh, my baby's not getting enough to eat. So helping moms know, you know, this is what you look for, these are the cues to know baby's hungry, this is how you know baby is getting enough, because breastfeeding's hard, so.
And it's important to be in a place that allows you to ask those questions and to know that you're not alone. Everyone's struggling with this. It's not something you just pick up, right?
Exactly. Even as a pediatrician, it was not. Like,
yes.
I remember the first time I was like, oh my gosh, this is a lot harder. So having that support is crucial. And making sure that we're all educated on how to provide that support is also crucial, because you never know when a difficulty is going to arise. It's going to be 2 o'clock in the morning when we don't have a lactation consultant like present in the hospital.
Yeah. So someone needs to kind of be able to be there and step in. So we have 10 successful steps to breastfeeding. I don't think we'll have time to get through all of them, but are there some that you would want to pick out that make sure people know today?
Yeah, so a lot of, like I said, a lot focuses on the support of moms, but also things like skin to skin, getting that immediate skin to skin to promote bonding with the baby, rooming in, so like making sure the baby is really with mom, well, I guess with the parents as much as possible, not going to the nursery unless medically needed or for whatever reason, just to promote, because that bonding is huge. So a couple of the steps really focus on making sure that bonding happens.
Okay.
And that is key to having a successful breastfeeding relationship with your baby.
Wow, fascinating. Well, of course, there are plenty of resources and other things if you do want to learn more. So you're going to want to take a look at your screen here for further information. SSM Health DePaul Hospital, continuing to provide exceptional women's health services and more. So all of that right there on your screen, their address, their phone number, their website. Thank you so much for joining us today.
Yes, thank you.
And for spreading some awareness this month. And we'll be right back.